Ovarian cancer. The purpose of this short video is to provide useful information for those ladies and their families with suspected or confirmed ovarian cancer. What is ovarian cancer? Ovarian cancer arises from the cells in and around the ovary and fallopian tubes. The ovaries are two small organs, each about the size and shape of an almond, located low in the tummy area called the pelvis. They form part of the woman's reproductive and hormonal system, storing a woman's supply of eggs. Ovarian cancer may also be referred as primary peritoneal cancer, cancer arising from the lining of the tummy cavity. What are the symptoms of ovarian cancer? Symptoms of ovarian cancer can be quite vague. They may include persistent bloating, not bloating that comes and goes, feeling full quickly and/or loss of appetite, pelvic or abdominal pain, that's your tummy and below, urinary symptoms, needing to wee more urgently or more than usually. Occasionally there are other symptoms, changes in bowel habits, like diarrhea or constipation, extreme fatigue, feeling very tired, unexplained weight loss. Symptoms tend to be frequent. They usually happen more than 12 times a month. Persistent, they don't go away. New, they are not normal for you. How is ovarian cancer diagnosed? If an ovarian cancer is suspected, an ultrasound scan and/or CT scan of your chest, abdomen and pelvis will be requested. These are painless tests that create images of the inside of your body. You also require some blood tests. These will include a CA-125. What is a CA-125? A CA-125 is a protein marker in the blood that looks directly at the ovaries. An elevated level does not automatically confirm the presence of a cancer, but does allow your doctor or nurse to determine the possible risks of malignancy alongside your CT and ultrasound scan findings. How common is ovarian cancer? There are around 7,400 new cases of ovarian cancer diagnosed in the UK each year. That's around 20 every day. It's the 6th most common cancer seen in women each year, with the highest incident rate in women aged between 75 and 79. What happens next? If ovarian cancer is suspected, you'll be referred to our regional gynae-oncology centre, currently based at the Queen Elizabeth Hospital in Gateshead. In some cases, a biopsy may be requested to confirm a diagnosis. What are the different types of ovarian cancer? There are many different types of ovarian tumours, classified by the types of cells and the tissue they originate from. Understanding the type of cancer, the histotype, if and how it is spread, the stage, and the potential aggressiveness of the cancer, the grade, can help you when you're discussing your diagnosis, treatment and prognosis with your specialist. However, some women may not wish to know so much detail. It is their personal choice. What is the treatment for ovarian cancer? Ovarian cancer is treated with a combination of surgery and chemotherapy. Your treatment will depend on the type of ovarian cancer you have, as well as the stage and grade. You may have surgery before starting chemotherapy treatment, or your oncologist may recommend starting chemotherapy first. This is referred to as neoadjuvant chemotherapy. Surgery may be considered after you have received at least 3 cycles of chemotherapy. Occasionally, if the cancer is diagnosed at a very early stage, it may be treated by surgery alone. In some cases, surgery is considered either too risky or unable to completely remove all the visible cancer, and chemotherapy will act as your initial treatment. All these treatment options are very effective. Your treatment will be individualised to you and based upon what is best for you. Upon completion of your treatment, your oncologist may discuss maintenance drugs with you, such as Avastin or PAR inhibitor. There are occasions where ladies are not suitable for either surgery or chemotherapy. In these cases, the management of symptoms becomes a priority. You will be introduced to a specialist palliative care teams at this time if needed. What happens after my treatment has finished? After completion of your chemotherapy, you will be followed up by your medical oncologist alongside your clinical nurse specialist, your key worker, for up to 5 years. They will discuss what this entails with you in greater detail. What support is available to me? Having a suspected or confirmed ovarian cancer diagnosis can be very difficult for yourself and your family. Your CNS is available to provide ongoing support throughout your treatment. You may also wish to access some online support, for example through Macmillan Support Line or via more specific ovarian cancer charities such as Target Ovarian Cancer or Overcome.